Antibiotic resistance is the ability of bacteria to resist the effects of antibiotics. It occurs when bacteria change in a way that reduces the effectiveness of drugs, chemicals, or other agents designed to cure or prevent infections. These resistant bacteria survive course of treatment and continue to multiply. It's important to know because it's one of the most pressing public health concerns. It can make illnesses that were once easily treatable with antibiotics become dangerous infections. In addition, antibiotic-resistant bacteria are harder to kill and much more expensive to treat.
How antibiotic resistance happens. The first thing that happens is that a ton of germs collectively come together infecting the individual. A few of these germs are also drug resistant. The second thing that happens is that antibiotics kill the bacteria causing the illness, but it also kills that good bacteria that helps protect your body from any infections. Third, now that all the good bacteria and most of the bad bacteria are gone, the drug-resistant bacteria are left to grow and take over. And lastly, the bacteria gives their drug resistance characteristics to other surrounding bacteria, which will eventually lead to more problems. People are overusing and misusing antibiotics. Overuse is when a person takes antibiotics, a few antibiotic-resistant bacteria are left, and then they grow and multiply. So when antibiotics are used too often, it increases the number of drug-resistant bacteria. Misuse is when antibiotics are prescribed to treat viral infections, such as the common cold, flu, sore throats, and bronchitis. Widespread use of antibiotics for these illnesses promotes the spread of antibiotic resistance. An incomplete dosage is when people stop taking their antibiotics when they start to feel better. Additionally, doctors are overprescribing the antibiotics. What are ways of preventing it? First, we must use antibiotics wisely and efficiently. The general public should only take antibiotics when prescribed by a certified health practitioner, never share antibiotics, prevent infections by washing hands, and finishing the course of antibiotics as prescribed to reduce rates of bacterial mutation. Here's what you can do to prevent antibiotic resistance. Tell your healthcare professional you are concerned about antibiotic resistance. Ask your healthcare professional if there are steps you can take to feel better and get symptomatic relief without using antibiotics. Take the prescribed antibiotic exactly as your healthcare professional tells you. Discard any leftover medication. Ask your healthcare professional about vaccines recommended for you and your family to prevent infections that may require an antibiotic. Never skip doses. Never take an antibiotic for a viral infection like a cold or the flu. Never pressure your healthcare professional to prescribe an antibiotic. Never save antibiotics for the next time you get sick. And never take antibiotics prescribed for someone else. Policymakers should ensure that there is a plan of action to tackle antibiotic resistance, improve surveillance of infections that are antibiotic resistant, the regulation and promotion of appropriate use and disposal of antibiotics, and health professionals should also make sure that their hands, instruments, and the environment is clean in order to prevent infections. They should only prescribe antibiotics when absolutely needed and in accordance with the guidelines. Doctors should talk to their patients about how to properly take antibiotics and make them aware of the dangers that come with antibiotic resistance and misuse.
Policymakers in Singapore have issued guidelines about the appropriate use of antibiotics and other antimicrobial medicines in primary care and community settings. They offer incentives to encourage doctors to optimize antibiotic use. Campaigns are being set up to educate the public on the myths and bad practices of antibiotic use, including the antibiotics' ineffectiveness in combating viral infections. This increase in surveillance of the use of antibiotics is all in hopes of lowering resistance.
An example of an effort to combat incomplete antibiotic courses was shown by a medical researcher in Cambodia. His team employed the idea of a contract between his team and the patient, indicating that they would finish the course of medication. Theoretically, this would allow the antibiotics to remain in contact with the bacteria long enough to eradicate it. However, this contractual obligation lacked a penalty or incentive, which ultimately led to patients not finishing their courses, regardless of contract.
In 2009, the CDC reported that Swaziland had the highest rates of multi-drug resistant tuberculosis, with 49.5% of previously treated tuberculosis cases having traces of multi-drug resistance. Furthermore, 15.9% of new cases had traces of multi-drug resistant tuberculosis as well. The National Multi-Drug Resistant Tuberculosis Program of Swaziland argues that poor retention rates is the main cause of the high rates of multi-drug resistant tuberculosis, and believes that implementation of tuberculosis facilities in rural areas will dramatically decrease the prevalence of multi-drug resistance TB.